So the Board of Health meeting in accordance with the governor's order suspending certain provisions of the open meeting law, GL 30A 20, relating to the 2020 novel coronavirus outbreak emergency. The February 25th, 2025 at 7 p.m. public meeting of the Norfolk Board of Health shall be physically closed to the public to avoid group congregations. Do I read the thing below it too?
No,
Okay.
you don't have to do that.
Okay.
That's fine.
So looks like the first thing on the agenda is the public hearing that you said Matt was going to address
Yep,
regarding 28 Grove Street.
Yep, it's a request for the variance to reduce the required distance of the septic tank from the required 10 feet to the foundation wall to allow it to be 8 feet. And then if you would Liz, do you have just the variance preamble? Not that there's anybody here, but just to make it official.
No, not in front of me.
Actually, I'll read it if you want.
Okay.
Variance hearing from the Board of Health Regulations is called to order for 28 Grove Street. It is my duty to inform you that you will have to provide the Board of Health with data to support your request for a waiver of Board of Health requirements, and that if you do not receive the waiver, it will do you manifest injustice. You will also have to show that what you intend to do is environmentally acceptable. Okay, I'll let Matt do his thing.
So this system has already been installed. When the plan had been submitted, I reviewed it, was fine. There were no variances at the time. What happened was when the installer went to go do the installation, they ran into an issue when they went to put the new tank into place. The new tank is a little bit bigger, bringing it up to code. The old tank was butted up against a significant ledge outcropping heading towards the back of the property. And therefore, there was basically no other alternative but to have that new tank set. And it ends up being about 2 feet closer to the foundation wall, which then brings it from that 10-foot requirement to the 8 feet. And that's what the variance is requested for. During installation, I did ask them, and they did comply to put a poly barrier against that part of the tank, which does not meet the 10-foot setback. Other than that, there's no issues. I said that's literally the best that they could do with what they were given without having to bring in huge hammers to try to jack ledge out. And even then, they were afraid the tank may not be able to be set properly and get an appropriate pitch. So I had no issues with it. The engineer had no issues. That the installer was good. And as soon as they were starting to remove the old tank and realized that they weren't going to be able to get the new one into place, they did let us both know, and we were in agreement that this would be acceptable. Just to make it official, we did just want to bring it to the board for a vote, since it is a local upgrade approval. The liner is reflected on the as-built.
Yeah, I don't know. Hopefully you can see it. I tried to zoom in a little bit and
Does anybody have any issues or concerns with this?
no.
All set.
Does anyone want to make a motion to accept the variance?
I will. Motion to accept the 28 Grove Street request for variance to reduce the distance of 10 feet from septic to foundation wall to 8 feet with Collins Civil Engineering. And it's already been reviewed by Matt, so.
I'll second.
All right.
All in favor?
Aye, Cheryl Dunnington.
Andy Bakanowski, aye.
Liz Gephardt, aye.
That was pretty painless.
So on to the next topic, appointments. We don't have any minutes. Has everyone reviewed the minutes, and are there any issues or concerns with those?
They're fairly brief, so
All right, if nobody has any issues, does anyone want to make a motion to approve the minutes?
I can make a motion to approve the meeting minutes from 12/3/24.
Second,
All in favor?
Cheryl Dunnington, I.
Andy Bakunowski, aye.
Liz Gebhardt, aye. And then new business is vote to appoint Rich McCarthy as representative and Betsy Joel as alternative to the Metacomet Public Health Alliance Advisory Board.
So the intermunicipal agreement that you all voted on and signed, I think 2 meetings ago, indicates that we need to have 2 representatives, and they have to be employees of the town on the Metacomet Public Health Alliance Advisory Board. So we thought it made sense for Rich to be the representative and for me to be the alternate. We'll be attending, I think, monthly. Is it monthly meetings, Matt?
I think they're gonna be quarterly.
Quarterly meetings, and then we'll report the findings back to you on what we're doing on the Metacomet Public Health Alliance.
They will be public posted meetings, similar fashion to the MEC dispatch. So certainly the board is always welcome to attend. They'll be posted in all 3 towns. But just satisfies the IMA that was agreed and signed by the 3 towns.
Matt, who are was it Amanda? Who are the representatives from Rentham and Franklin?
I am primary, Amanda's secondary for Rentham, Franklin, Kathleen is primary, and I don't know who they made secondary. I've not seen that yet.
It wasn't Ginny?
I don't think so.
Okay.
It might have been Cassia.
Oh, yeah, you're right. It might have been, so. Anyway, did you have any questions on that?
Where are the meeting held? Where are the meetings held?
I think we'll probably rotate between the 3 towns
Okay,
just to make it fair and equitable.
okay.
All right, does anyone want to make a motion to vote for Rich and Betsy?
Cheryl, you just do such a good job.
All right, so I will make a motion to appoint Rich McCarthy as representative and Betsy Fiegel as alternate to the Metacomet Public Health Alliance Advisory Board.
I'll second that.
All in favor?
Cheryl Dunnington, I.
Andy Bakunowski, aye.
Liz Gebhardt, aye. The next new business was to discuss if Velo nicotine patches are considered flavored tobacco and consider updating the regulation of the Norfolk Board of Health restricting the sale of tobacco products.
We have our tobacco control rep Pari on the line. And Pari, you're muted.
Hi, thank you for having me. My name is Parivalal Govindan, and you can call me Pari. I'm the Tobacco Control Program Manager. I'm based in the city of Framingham. I work to 16 communities in Metro West. So the program comes under MTCP DPH, Massachusetts Tobacco Cessation and Program. I was in Norfolk a week back doing my inspections, and I came across few products which are flavored. As of now, in Massachusetts, flavored tobacco products are banned since 2020 June onwards. But still, there are products not in cigarettes. Cigarette is controlled by the state, but the cigars and nicotine pouches and vape products are still available. Flavored products are available. For example, I saw this product I'm just having. I bought this in Norfolk. And we tested this here in Framingham with our employees. Like, it is flavored. By smelling it, you don't get any flavor, but we dip it in water and we smelled it, and tasted it. It has sweet taste in it. So the MTCP has given the guidance document that Board of Health can decide on flavors which are available in the particular communities. One of the community, Concord, where I also been appointed as the tobacco agent, they had tested on different products, like 10 products as of now, and they did flavor, including Zinchil. And then we are actually enforcing on them. So I spoke with Betsy regarding this, what is happening in other towns, what products are available in Norfolk. So with the suggestion from Betsy, and we are working on the Board of Health regulation to update the definitions. And I would suggest Board of Health permission and suggestions to work on this enforcement of flavored tobacco products in Norfolk.
So how many of these Velo nicotine patches are flavored? So is it like the whole line or is it a couple of them?
I would say like if they have around say 10 nicotine pouches, among that 1 or 2 is flavored.
Okay.
For example, Zin has Zin has 2 products, one is Zin Chill and one is Zin Smooth. So
Mhm.
just Zin Chill is flavored and Zin Smooth is just nicotine.
Okay.
And Zin Chill has been, this is information for the board that in California, the Justice Department has decided to ban Zin Chill, adding a bill from January 2025 onwards that any tobacco product having a chilling effect is considered flavored. So they have banned Zin Chill in California. But in Massachusetts, the first community to ban Zin Chill is Concord. This is just give an update for the Board of Health. Yeah.
And I know Mansfield, I saw it on the news, but I haven't been able to read their minutes because they haven't posted yet. So Mansfield was bringing the same thing up. I don't know what they ended up deciding.
Yeah, today we had the enforcement on Zinchil just to inspect and whether they are still having on shelf. Cease and desist has been sent to all permit holders in Concord, and it has been removed from Concord now. So if the meeting happens in person, I would be happy to bring the products so that, yeah, I don't know how to go with this. Then, yeah, that is the status now.
I think we need a list of products. I don't know if you sent us a list, but the exact products that are considered, because I know there was one thing that said, a letter that said it wasn't considered flavored. That got sent in the packet that Betsy sent us.
Yeah, that word characteristic flavoring.
Yeah.
Yeah, so what happened
What
is-
does that mean?
Yeah, so characteristic flavor as per the MTCP guidelines, the definition of characteristic flavor is any flavor or aroma or taste other than nicotine or tobacco is called flavor.
Okay.
Yeah, it can be mint, it can be menthol, it can be fruit, it can be anything. Scent.
What it's interesting. The product line, though, that Velo product line is the one I'll call it brochure I saw had 6 different packages that all had a specific flavor on it. So
Yeah, that's what I saw.
I'm totally lost as to why someone would say that it doesn't meet the definition of characteristic flavoring because it's flavored. Does that make sense? It's almost, it seems to be a play on words, I guess. So,
Yeah.
Okay.
So the state's situation on flavor ban is they had given the Board of Health the authority or to define flavor on cigars, vape products, and nicotine pouches. And I believe the state is only looking or enforcing on cigarettes because cigarettes have state stamp and the DOR is following on that. And cigar pricing is fixed by the Board of Health. So they expect the Board of Health to decide on the flavors on these other products other than cigarettes.
So you said you did an experiment at your facility where they had a flavor and a scent. And you're asking us now if we need to do it in person, or can we just agree with you that it had a flavor?
The
or a
MTCP
scent?
guidance suggests the Board of Health to decide on the flavor. Because if I decide, it might be biased. So I think, yeah.
So we have to get together and sniff this tobacco, is what
Yeah,
you're saying?
that is what the guidance document, which I shared with Betsy, is mentioning. Yeah.
Well, I think we did this with the vapes a while ago. They brought all the bubblegum vapes and stuff like that.
Yeah.
I missed that day.
Yeah.
Remember all the products that he brought?
Oh, yeah. So what if we had like a list of the products and maybe since our next meeting is probably going to be in person, right, Betsy, in March? maybe we kind of hash out exactly which is which, so we can have a further definition, or do we want to just say all Velo nicotine pouches are considered flavor and therefore banned in Norfolk?
Yeah, the new, I mean, the new model regulation for the sale of tobacco restriction from MHOA has suggested the Board of Health can get rid of nicotine pouches from the community, or they can move the products to adult only store if you have an adult only store, because Norfolk doesn't have an adult only store. If Norfolk Board of Health is deciding we don't want to have now, I mean, nicotine pouches in the community, that can be the Board of Health decision on that. Or you can also go for restricting the milligram of nicotine in the pouch, because it ranges from 3 milligram to 9 milligram, even 12 milligrams. And yeah, so the Board of Health can decide on, we are going to allow only 3 milligrams in the community. Yeah, so that is why we are working on the regulation as of now, including all the definitions, but as per the latest model regulation. As Cheryl said, we can, by the next meeting, we can be finalizing or sending the first draft of for your approval, and I can also bring in the products what is available in Norfolk.
Pari, can you get us a draft of what's going on in Concord? Just to take a look at and see what's there. I mean, if they're it seems like they're a little bit ahead of us in terms of pushing some of this. So I think
I can send you the draft, but I can give you a short brief note on what is happening.
okay.
December, actually October, they voted on adopting the new nicotine-free generation policy, and from January 2025 onwards in Concord, Concord became the 12th town at that time. Now we have 14 towns in Massachusetts adopting nicotine-free generation policy, which allows anyone born on or after January 2024 cannot buy tobacco product in that particular community who has adopted that policy. That has been implemented, and now January onwards it has been in place. And after that, now the board has gone for this flavor enforcement based on Board of Health decision on flavors. And they have, as of now, they have banned 10 vape products and nicotine pouches from the community. And today I was in Concord and I have bought them like more than 12 to 15 vape products for deciding whether they are flavored or not. Maybe tomorrow or next week we'll be deciding that. I think, I mean, the enforcement cease and desist has been sent. I think they are all compliant, and there was one appeal for the Zenchil from 7-Eleven, but they have not shown up for the appeal meeting, for the Board of Health meeting, so it was denied, and that is its status now.
What do you guys think about the nicotine free? It's after 2024, is that what you said? Anyone born after 2024?
I think that's one of those feel-good things, because it's not going to impact anybody right now, so nobody's going to get mad at you. And the only people it's going to impact are the kids when they finally get to be older. But
We'll be dead. No, I'm just kidding.
Yeah, well, no, yeah, it will be. This one, will be what, like,
And to be to make it clear, nicotine-free generation policy is completely up to the Board of Health. It is not a state policy as of now. They have mentioned it very clearly for FY25. It is not priority for the state, but the Board of Health, if they are willing for it, they can go for it. That is the status now.
Let's see, what is ours for the minimum age to buy tobacco? It's 21, correct?
21,
Yeah, it's 21
Right.
across the state. Yeah.
All right.
We
So-
actually, we adopted the 21 before the state did.
Right.
Well, I feel like I'm biased as a physician because all I do all day is ask people, are you smoking? How are we gonna help you stop smoking? So I'd
Mhm.
rather them not start, so I would be
Yeah.
happy with the nicotine free.
Right.
But that would be my opinion.
So is there anything that we need to do tonight, Pari, or do we just wait and see the
Yeah,
draft regulations?
Yeah, I will be working on the draft regulation and I can share it with you and the Board of Health through you. And if there is a in-person meeting the next time, I can bring in the product, what is available in Norfolk, so that the members can feel and see what is the products available and they can decide on enforcement. on that.
Okay,
Okay,
Great. Well, so
sounds
we'll-
good.
We'll look forward to that draft and then we'll continue the discussion on March 25th.
Okay, thank you so much.
Thank you, Pari.
Okay.
Bye.
Bye. Next is Matt Tanis, environmental health agent, and Carrie McKay, you said it's not coming. Any updates?
Nothing really too much. Septic has been somewhat slow. I think there's a number of reasons for it, but I'll just chalk it up to the freezing weather. We've had considerable frost and it's been making perks difficult. And even new installations. I just had one last week that they were trying to cover with tarps to try to keep the frost down. So just the weather's been a little problematic, but it's breaking now, so should be good. I have another perk on Thursday, so hopefully with spring things will start to be picking back up. Other than that, just working with getting all the stuff with the Alliance and the IMA fully put together and up and running. We'll probably be having our first quarterly meeting next, I'm hoping in April. So that's about all I have. And Carrie hasn't said there's been any issues on her end. I know she's been out doing some inspections, so.
Yep, she's moving, she's actually been moving right along with inspections in Norfolk, so she works in Norfolk on Thursdays all day. So she's been seems like she's been doing a pretty good job there. So yeah, I'm getting caught up with inspections, which is great.
Good. Anybody have any questions for Matt?
no,
Next is 111 Dedham Street, former Southwood Hospital property updates, and discuss the presentation. Is that we were talking about your presentation?
Yeah, and his presentation.
yeah, Liz, do you want me to put this in some context?
Well, I saw the presentation that you had.
Mhm.
Yeah.
I don't
It's
know where.
heavy.
Yeah.
It's heavy. I mean, one of the reasons for doing it is, sitting at town meeting, there was I'm not going to say a concerted effort, but there was clearly an effort to try and limit the changes to the zoning. And I think there was a reluctance by a few to distance the zoning changes with the existing environmental conditions there. Having been in the environmental field now 40 plus years, being in an LSP, and looking at the zoning changes, and there seems to be I'm going to say it's a perceived disconnect on my part that the zoning is affected by the contamination that's there if they can't clean it up to non-detect or below background levels.
Mhm.
And that seems to be something that people just they just don't want to seem to deal with it. This whole idea sort of came up after listening to and seeing the discussions with the selectmen doing the developers agreement, which is online if you want to see it. It's between the town and GFI, and then dealing with some of the contamination, the cleanup standards, and timelines for some of this stuff. The curveball that got thrown probably about 2.5 weeks ago now, and I sent that email to Betsy, which I hope she forwarded that off to both you and to Cheryl about the DEP's discussion with consent order. While it doesn't necessarily change the cleanup standards, it does change the schedule. A consent order essentially is a little bit of I'll say it's a fudging of the timelines under the MCP, and because it's a legal document that both parties agree to, it can be modified, but generally this sort of becomes the new path. And looking at the developers agreement and I think the expectations of when things get cleaned up and when they start development and the expected income coming in from new taxes of the development, it's this consent order will change that. So this was not expected by anybody, I think, when they were looking at this whole development agreement. I don't even think GFI knew this was coming either. Some of this happened after the after town meeting. But that being said, the whole point of doing this is to simply provide people with what the process is, because that's never been discussed. The planning board isn't doing it, and actually the Board of Health is the lead town group by statute and by regulation for hazardous waste. And so it's fallen to us, the fact that no one else is doing it and no one's volunteering to do it. I mean, we need to step up on this. I mean, this site is complex. I mean, I've worked on more complex sites in my 40 years, but the interesting thing about this one is that the history is so long on this, is that I don't know if you can say after this next round of testing is done that they'll have everything identified. I just don't think they will, but that's my personal opinion. But so, and the whole point of putting that together is simply just to educate people. And I think that's a role that the Board of Health should be playing in town, is educating people on what we do, what we can do. And I'm knowledgeable enough about, having been on the site 35 years ago when I was on the Conservation Commission, because I've seen some of the problems that they're running into. I'm willing to do it, and if the board agrees with that, we can set up a time at the library or one of the schools and simply just have a workshop on a weekday night or a Saturday morning or something like that. We can figure that out in the coming months. But so that's kind of where I'm at.
Now, have you passed this through the select board and the town administrator?
Justin saw it. I would say he seems very reluctant about this, but then again, the Board of Selectmen are not the lead agency. I mean, that's I can dig my heels and say, look, they're not the lead agency. But then again, if the transparency and collaborative effort of putting that developers agreement together, they may want to reach out to the Board of Health and see what our take is on it. Are they working in a vacuum? No, but they're working, with guidance from someone, whether it's council, whether it's other people in town. There are issues with that developers agreement, and I've worked on, I'll say maybe 10 to 15 over my time, and there's holes in there that should have been addressed. I've seen agreements before the town, when the town was going to take some of the Buckling Van property that includes the activity and use limitation, because they want to put rec fields on there. And obviously what an AUL is for over there is that there's contamination that's above risk-based standards. Why would you want kids playing on that area? So, and that was, that came directly from the two former town administrators and the select board. So, this is part of the education that I think has to go on, because I'm just not saying. I think we as a board have an obligation to make sure people understand what's going on and giving them the information they need.
Well, I agree on that. We need to make sure that we're working with other people, other boards. I don't want to have it that somehow something gets presented and it's the Board of Health's perspective, and it may not necessarily be the Board of Health's perspective. It may be more your background and your knowledge about it. But I would really like to make sure that the administrators and the select board were okay for the presentation.
Yeah.
That's my thing. I want to make sure that they know, so that they don't get blindsided.
Okay, well, I mean, they have it. I saw Rich 2 weeks ago after I gave it to Betsy, and I said, the planning board's not doing anything with this. The select board isn't doing anything. Zoning's not doing with it. Who's, what are you doing? And he just sort of shrugged and looked at me and kind of said, I think it's sort of I understand that, but he didn't say anything. So I'm not clearly sure what he's thinking. I mean, he expressed his concern and said that I shouldn't be doing it. It's like, okay, well, who's gonna do it then?
Should we invite them to a meeting to discuss it? Because again, I agree with Cheryl.
Yeah.
My concern is you know way, way more about this than I do.
Mhm.
So I don't have any input for it, and I don't know how much Cheryl does, so that's one of us with the information, and I don't know that we have, I don't want to say fact checker, but fact checker, like, I don't know enough about it to agree or disagree with you.
Right.
And so I'm concerned about that without having other people in the mix that
Mhm.
know more about it than I do. You want to talk pneumonia? Yes. This other stuff you're throwing out there. I don't have the basis to be an expert.
Okay. Yeah, no, I mean, this is the first start. I mean, I worked on it, put it aside for a month, kind of went back to it, cut it down quite a bit, and then figured it's at a point right now where if I cut it down more, it's basically going to be basically just a watered down, you know.
Yeah, and I don't necessarily think it needs to be watered down, but I think that we have to have a more formal discussion with more town board members than
okay,
just
yeah.
us, if that's, and if everyone's in agreement with that.
Yeah, which is fine. And I mean, my feeling is inclusion, with everyone. If you're given the opportunity to, present, comment, whatever, that's fine. But simply just to say, you shouldn't be doing this is, I mean, it's like, okay, that's doesn't cut mustard. So.
Well, that's why you get multiple boards on also, so that everybody's fully aware of it, not only the select board and the town administrator, but you get the zoning and stuff like that. And then everybody's aware of it, the project and, or the presentation. And I think also too, to have people understand the presentation and be willing to say, okay, this is from the town, not necessarily from a specific board, but it's from the town, or the following boards have been involved in this type of deal.
Okay. Yeah.
Do you think that's something we can do, Betsy, for the next meeting, or provide them with the presentation and see what they have to comment?
Sure.
So, I mean, if we have to, if I have to, I mean, I'm more than happy to go to planning board meeting, tell them what's going on. Zoning, I don't think, I mean, zoning, I'm not quite sure what they can say, because it's up until, a variance of the zoning is going to happen. It's not going to, they're not doing affordable housing there or anything like that falls under their preview. The select board, yes, they have that developers agreement, which I already told Justin that, that's going to have to be changed based on the consent order discussion. And that's something I don't think they saw coming, and that's something that will affect timing. So, it's, believe me, this site it's fascinating to the point of being, you got to juggle a lot of balls in the air with it. And that's, that's part of it. My whole intent is to make people realize what the regulations are that we, as a board and, that the developer has to deal with too. So I can't say they're definitely going to, agree with everything, but, this is what it is. The fact that the EPA has been doing work out there, and given the nonsense that's going on in Washington right now, that may never get done. Even though that consent order said that they're committed to getting it done, in April, May, fine, you get the work done, but then the report comes, and the question is, how long is that going to take? It may never get done. So, that's something that should be thought about, because I know GFI had relied on the EPA to do a lot of this work for them. So, and then if that doesn't go through, what happens? Does the developer then go back and redo that work? I don't know. So
There's a lot up in the air, it sounds like.
yep, it is. And I'm not going to say that this, I mean, they've owned the property now for 4 years, and I'm not criticizing how they're moving along with this, because this is a complex site. I mean, the 100-year history of the property, let alone of information, that I know is out there from past residents that live there. I mean, there's a woman in Norfolk that was a nurse there. She's in her 90s right now, and she's still sharp. She's sharp enough to know where things happened. And there's a lot of things to consider here. So
Okay. Then next, Betsy, you sent us stuff about Norwood. Or are we supposed to talk about that tonight, or is that just FYI?
That was kind of an FYI, but I didn't know, Cheryl, if you had any updates.
No, I haven't had any. I know that they're trying desperately to go to the governor to say what the need is. And like I said, in one of the last meetings I went to, there was definitely a few hospital systems that were not happy about having a hospital there because it would impact them negatively. So, especially after all the hospitals that were taken over by Stewart. So I know, and I've heard that UMass was interested too, but I think the big issue is that the hospital license expired. So there's not, it's just land now. It's just a hospital. There's no license to actually have a hospital. So we would have to get approval from the state to have a license in place. So somebody could possibly purchase it. Because I believe it's if not done, almost done. It's just the interior work hasn't been done.
I hadn't heard about UMass, because UMass just took over Milford. I didn't know that they were looking at that hospital as well.
Yeah, the UMass
Seems
is
like it would be competition.
I think for UMass, it would be great. It gets you more in the eastern part of the state. I know, BMC took over Morton and Good Sam and St. E's, so that would be an issue. And I know the state doesn't like it when Mass General Brigham takes over more hospitals, although that would be a perfect place for Mass General Brigham, in my opinion, since you've got the urgent care and all the outpatient clinics and stuff right down the street. So.
I don't know.
So I think that's what they're trying to figure out. They're trying to get to the governor to say, hey, because there's been a lot of misinformation. So there's been a couple of senators representatives from the northern part of the state that said, oh, they're not even doing construction anymore. And in reality, Norwood was continuing to do construction. So right now, the Norwood town administrator is working really hard with everybody.
Well, I went on the website or whatever that was there. It seemed like they're just looking for someone to purchase it, like a big conglomerate or whatever.
Yeah, the problem is nobody wants to purchase it because there's no hospital license. So you're kind of like in this limbo, the chicken, before the egg, excuse me. You don't have a hospital license, so you can't have a hospital, but you don't have a hospital because you don't have a hospital license kind of deal. So
Yeah.
and nobody, and again, it's not like somebody could buy the land like they've from the group that Stewart sold all the land to. So theoretically, someone could buy the land, but it's useless if you can't put a hospital on it if you don't have a license. So that's what they're trying to get the approval or get the okay from the governor, say, yes, we'll give them a hospital license. I mean, everyone's talking about how we're so underbedded right now. And, my daughter, excuse me, my daughter works in a MICU and the flu A is through the roof. So, and
like a 6 to 9 hour wait in the ERs.
Yep. I mean, the Faulkner just added, another 70 beds. The Mass General is looking at adding more beds. So I won't get on my soapbox about healthcare and how, 20 years ago, everything was going to be outpatient, and they forgot to realize that there were a bunch of baby boomers that were going to get old and would need hospital beds. So.
All right, we'll wait and see what happens with that. The next thing is that the 2025 meeting schedule, March 25th, it looks like the next one.
Yep, so we'll plan that one in person.
Okay, sounds good.
Wait, where are the in-person ones? Sorry.
At the town hall, I'll have to take a look at the meeting room. I'll be in touch
Okay.
on that. I just need to check the meeting room schedule and book us a meeting room.
Okay.
Okay.
Any other unanticipated business?
I have nothing.
Nothing? Anybody want to make a motion to end the meeting?
I'll make a motion to adjourn the Norfolk Board of Health at 7:40 PM.
Second,
All in favor?
Cheryl Dunnington, aye.
Andy Bakunowski, aye.
Liz Gephardt, aye.